So I am here on the premises of the University of Ghana Medical Center located at Legon in Accra, Ghana, the first and biggest of its kind in West Africa. And it has three different units, the first one being a science research center and also a 1,000 bed clinical facility, and the third one being a training and simulation center, all here as part of the University of Ghana Medical Center here in Accra. And I'll be speaking with the Chief Executive Officer of the facility, Dr. Darius Osei. I am Bright Nanakwesi Amenin. All right, so I'm here with Dr. Darius Osei, who is the CEO for the University of Ghana Medical Center here in Accra. And we want to find out, we've been told that it's fully operating, and now the first phase was integrated, and the second phase, which I've been told it could be said as a shell. Okay, that was the first phase. And the second phase with the operation is now ongoing here. And I've been joined here by the CEO of the medical center, Dr. Darius Osei. Now, when we say fully operational, what do we mean by that?
Well, it means the structure process has all been put in place, and the structure here means the buildings you see were all ready in phase one, but it was only a brick and mortar. And then phase two completed some of the chambers that will make it functional. Apart from that, we were just limited because of the lack of functional beds. We were just operating 100 bed as against the potential 1,000 bed, which means in the beginning we had to scale up gradually. The scope of all the expected services were not ready, and we were limited. The second phase brought a lot of finishing, which made the first phase functional. A lot of meaning in the first phase. The first phase, we were operating the outpatient department and just 100 bed, the ground floors. The second phase completed most of the other floors, which means we needed to employ the required staff, the mix of different professionals, both administrative support services as well as the clinical staff. So presently, we've managed to have over 800 staff, about 147 doctors, over 400 nurses of different category. Being a quaternary hospital, it means you are looking at specialized clinical staff, that is critical care nurses, midwives, in ICU nurses, and so on and so forth. In a similar fashion, you also need different subspecialists in terms of doctors, right? And so fully functional means that you have also designed the patient care path, being a new facility, not already in operation. It means new people who have been employed into the facility must be trained to have that patient experience and the provided experience as well. And then, these electronic medical records. When you have employed people coming from different parts of the country, you don't just ask them to start working. So the 4 years from 2018 to date means we had to go through all these processes. And again, it was a turnkey project, which means the contractor built and then he equipped and transferred. Now, these are medical gadgets that needed testing. The standard authority needed to pass them. The HEFRA, that is the Health Facility Authority, had to give us accreditation for practicing. The Radiation Authority have to test the radiation levels of all the photo imaging facilities. So you don't just open a hospital and then start. So we have gone through all this process of getting the right authorization, getting the right persons to manage the different areas, and then also tested the patient path in terms of how they get themselves registered, they are supposed to do, especially in an electronic medical records environment. And so now I can say the 1,000-bed has been fully are all functional, and nurses and doctors have been distributed to their various areas. And so we have the laboratories, the photo imaging, and all the other areas functioning. So when we say full operationalization, it means we have gone through all these various scenarios that I have explained to you, talking about the structure itself, which is made up of the materials to work with, the manpower needs, and then the infrastructure itself, functionality, and then the process of work, how to eliminate duplication of services, how to properly train your staff, and then make sure that the outcome of care is realized to meet the objectives of the establishment. And then again, this facility is looking at 3 major areas. We are looking at...
I was going to come to that. Let's start with the 1,000 clinical system section. Tell me about that.
Yeah, well, if you look at building 2 here.
This is the building 2.
Yeah.
The women and children.
So if you look, we have the consulting rooms, which is the obstetrics, gynecology, and then pediatrics consulting rooms. We also have the obstetrics emergency, and then we have the pediatric emergency, all in this building. Then we have the pediatric ward itself, and then we have the new natal intensive care unit, that's the NICU. And we have the pediatric intensive care unit, we have the pediatric surgery unit. And so when you talk about pregnancy in itself, right from the beginning, antenatal, through to delivery and postnatal, we can all have them here, as well as all the complications that comes with it. If children needs to be operated, if mothers in the course of pregnancy have some complications. And then very top also, we have the artificial reproductive technology, what popularly called IVF.
What do you mean by that? Break it down for me, for the layperson.
Reproductive technology. That is to do with people who are in need of children, and childbearing becomes a challenge. That is, we popularly use this balance IVF or whatever, right? So that is on the top floor, which is also ready. So all issues concerning making babies, looking after babies and their mothers as well, can be taken care of in this building.
And it has its own full blog.
Yeah, so it's called the Women and Children. That is what it means. And then when you look at one of the branches here, that is the medical training and simulation. It is supposed to be the biggest in the sub-region. Yeah. We train medical students in the past using sick persons as experiment. Can you imagine you are already in distress, and then we have thousands of students coming around you to use you to, study. Now, here we have the simulation rooms, the mannequins, and so on that students can use. It is also a place to train not only medical professionals, but also people like you, just to know the basic life skills that if somebody falls, all of it. So as I speak to you, State Transport Corporation have a contract. Their drivers, about 50 of them, are coming to be trained so that at least they can get themselves abreast with the basic life-saving skills. We have already trained about 200 personnel of the consolidated bank personnel. Accident at workplace, somebody falls, and what do you do? So it has a multifunctional training, and it's not only limited to the government medical students, the private medical schools, as well as institutions, the allied health, and all of them can have access to training themselves.
Pardon me to intercept, but then as you mentioned 2 institutions that have already been here for your training. First the State Transport Corporation and all that. Now, let's talk about money issues here, financial issues. Is it for free?
It's not free, because the place must be maintained, mannequins must be replaced. But there are structured fees that are affordable and reasonable so that we can make training easy as well. So it's not for free. So
So this is it's supposed to be the biggest in West Africa, the Medical Training and Simulation Center. So far, the biggest in West Africa. Let's now talk about the third one, which is Science Research Center. Tell me about that.
yeah, medical research is also important, especially when you are dealing with high-level medical practice. You know, when you are going to do artificial reproductive technology, when you are going to do cardiovascular, genetic medicine, all of it must have some research basis. So what we have done here is to make sure that we have the requisite personnel, the research fellows, which normally are not in the payroll structure of the Ghana Health Service. But we manage with the Fair Wages Commission to convince them and bring in fellows who more or less have their conditions of service, just like the university lecturers. So we have about 5 fellows of research. In this case, grant writing for research will be easier for us. And then so far, we managed to, we became very popular during the COVID period. Yeah. So we managed to get some funding through grant writing for COVID research and so on, because we have a lot of data available, which can be very meaningful in terms of research. So these are the 3 major areas: the medical simulation and training, the research, and then the clinical services.
These are all very sweet statements, and hopefully helps Ghanaians and reduce our health problems. But let's now talk about one of Ghana's biggest problems. Is seeing our politicians and our president fly out of the country for medical assistance outside the country. Now, will this facility solve that problem?
Definitely so. I mean, this is the main objective. The facility is supposed to answer the problems of medical tourism, cutting edge medical care, the subspecialty specialist services, cardiothoracic, urology. You're talking about gastroenterology. We're talking about all these are very specialized services that already Kwalebu is giving that sort of service already. But I must say that
given, but we still see our presidents and
So
our politicians travel out of the country.
If you have 2 or 3 of the such facilities giving the same service, then definitely access to healthcare is much more improved, because one of the dimensions of quality healthcare is easy access to healthcare. And so if people are queuing now for these kind of highly skilled services, and then we have one more in place to complement, then I'm sure we are going to answer the needs of the people better.
One very interesting point I've also picked up from Ghanaians is that they believe this place is specially made for a certain type of people. How true is that? And if it's not true, you want to debunk that?
No, it's not true. It is meant for all category of persons who are referred to as to take care of. I mean, healthcare, one of the dimensions of quality healthcare is equity of care. And so it answers that question, definitely.
Another issue to that, I mean, there are some hospitals you go and it's either you are referred to by a different hospital or not. This place is just a walk-in. Is that how it works here?
Well, when you talk about specialized care, I mean, I've described that, look, if somebody is pregnant, he doesn't need to be referred here. You can walk in and decide that, look, I want to use Ugmc and go through my labor and deliver and take. That doesn't need a referral. But if you have a cardiac condition, for instance, definitely it means somebody at the lower levels is seeing you. And what you are saying is that if you are to come to us, let's have some form of referral where your status and conditions are clearly articulated. Then we can continue, definitely. I mean, we are not encouraging people with the top 10 conditions like malaria, respiratory tract infection, and others. Unless they are complicated, then they can come to us. But we will encourage that they are seen by their lower levels, and then when it has gone out of hand, then they can actually seek our opinion, so that we can allow the professionals and highly skilled people to focus on these high-level services.
Let's not talk about maintenance. I mean, we don't want to wake up one day and realize a department of this hospital is not working. How are we going to ensure that each and every part of this particular community, as you say, it looks like a community is working effectively as it should be?
Right, definitely. We have not lost sight of the fact that hospital must be maintained. And as the contractor hands over to us, we've entered into a lot of agreement with the vendors who were the subcontractors for the contractor to continue. But definitely you will need to maintain these facilities with money. So as we scale up, there's going to be a budget line that will take care of the various activities and make sure that the facilities are functioning.
That budget is not ready yet?
Well, that is what we are doing now and telling people to have access. Definitely there's every activity has a price tag. And so if you are to maintain, then you have to generate money to do that maintenance. And then we are aiming at self-sustaining ourselves, which means we should generate enough to be able to take care of the various line items that comes into taking care of patients and then maintaining the facility as well.
How much money do you think we would need to make sure we maintain this facility?
It's premature for me to do. We have to get our benchmark figures at least when we enter into these agreements. They are planned preventive as well as corrective maintenance. Planned preventive is the structured one where whether the thing is working or not, people come to see and then advise what to do. And corrective measures, we don't have control over it. You wake up one morning and then all the lights are off. So you cannot put a figure to it. But as much as possible, by a certain time, we should have an idea that, look, you will need this amount of money, both for corrective and then preventive maintenance.
Right. Thank you so much. Anything you want to tell Ghanaians aside what we discussed?
Not much, just that we are all excited that it has taken a lot of effort. I want to thank all the managers of this facility for exercising a lot of patience because, most people were in a hurry, but it is healthcare. And once you're going to work on human beings, then you must understand what goes into it in terms of, structure, process, and then expected outcome. Now we are sure that we've been able to place ourselves in that position where our structure, in terms of manpower needs, in terms of materials to work with, it's good enough for us to take off. And we have also simulated a lot of the processes in terms of patient care path, our experience, and then, identify most of the gaps. There are challenges that we continuously have to work on, though, but I'm sure we cannot wait forever for us to be perfect human institutions, but continuously we'll continue working towards making sure that the facility is functioning. But from what we see and what we have assessed, we can confidently say that, look, the facility is ready and we are here to complement the tertiary institutions, and then we will decongest the queue and then also improve upon the no bed syndrome.
All right, thank you so much. So Dr. Darius is the CEO of the Legon Ghana Medical Service in Accra. Myself and some staff members of the facility, the University of Ghana Medical Center, will take you on a tour and show you around to let you know what exactly it looks like here at Ugmc, the facilities, equipment, and staff.
So I'm Letitia Pomechampo. You are warmly welcome to pediatric OPD. So at the OPD, this is our waiting area. So when the clients come, we welcome them nicely. Then we give them a seat, pick their cards. Then they'll be waiting whilst we call them in. All right. So when they are whilst waiting, we have the kids. We have our playground here. So with our playground, we have a puzzle, and they have a ball to also be playing with. So when they come, we want to make them all feel comfortable. They shouldn't feel like they are in the hospital setting. We want the place to be in such a way that they'll feel like home and they enjoy themselves.
Okay, so I'm Michelle Asantua, a staff of UGMC and at Baby Suits. Okay, so this is the babies unit that we actually take babies that are not vaccinated. So over here we have a 20 quart capacity. This is our warmer. This is our firefly specifically for babies that are jaundice who needs to undergo phototherapy.
Okay.
Okay, so these are the cots that we keep our babies in. These are phototherapy machines too. This seems to be more faster than this. So babies that have mild jaundice, we use these phototherapies for them, phototherapy machines for them, and babies that have severe jaundice too, we use that for them. This are monitor that we use to monitor babies that needs to be paid more attention to. Okay, so this is our oxygen stand too.
Only for babies.
Only for babies. And so that's basically all about it.
How many of these beds?
We have about 20 cots capacity. So these are the cots, and we have about 20 here in the unit. But for now, we do not get so much babies coming in. We have just a few.
Because it's newly opened.
Yes, it is.
I'm Gifty with the pediatric unit.
Okay.
This is our massive playground for all the children who are on admission at the moment. They come here to play and have fun and then also learn when they are on admission. Sometimes it's a recreational site, a place for them to also come and then stretch. Yes. We also have physiotherapy sections here. Sometimes the physiotherapist comes around and takes them for walks and everything. Yes. So that is the playground for you.
All right. So anybody from outside cannot just walk in here and say.
No, please. It's for the kids on admission, for our patients on admission at the moment. Yes.
And so here is also a different playroom for kids who have undergone surgery on admission and will not be able to go out there to play with the other kids because they need extra attention. So come, let me show you. So yeah, it's as usual, just like we saw out there. But this place, the floor is really comfortable compared to what we saw out there because of the kids, the type of kids who are allowed to come in here. Those, like I told you earlier, those who have undergone surgery and those who are on admission. They are those ones who actually come here for this playroom.
My name is George Nunu. I'm currently the head of radiography and sonography at the imaging department of Ugmc. And currently we are about to enter the cath lab. Okay, this machine is used for angiography studies. That angiography means study of the vessels of the body. Okay, we use it for cardiology, we use it for interventional radiology, for what we call TACE, liver ablations and all that. Currently, this is the only model in Ghana and West Africa. It's a Philips high-end angiography machine. But it was just installed like less than 6 months ago. And currently we have a lot of cases currently being used for, especially for cardiology. Currently we are at an MRI unit, and MRI stands for the magnetic resonance imaging. It doesn't use any X-ray, so therefore it's very safe to use in pedics. Okay, the details from the MRI is also very high compared to other modalities. Hence, it's very useful in neuroimaging and pediatrics. Okay.
And just so you know, this machine is always supposed to be on.
So as you can see,
yeah, okay, it's been here.
always
we
on.
can't enter, okay, just for precaution's sake, so we can't go in there. But it's always supposed to be on.
Yes. And no metal is supposed to enter the machine. When you are coming for the procedure, you have to be screened. Everything metallic on you has to be removed. Your watch.
What happens if you go in there with the metal?
You'll be stuck to the machine.
You'll be stuck to the machine?
Stuck to the machine, as you can see. And if you stuck to the machine, you have to demagnetize the whole system. And that's a lot of money. Millions of cedis.
This is the Medical Training and Simulation Center of the University of Ghana Medical Center. Here we use electronic gadgets called mannequins, some of which are high fidelity, others are low fidelity, to train health and non-health professionals. In the training of health professionals all over the world, we use simulations. You know, that means that you simulate what happens on the wards, at the clinics, in the hospital in general, you know, to train students, pre-service health professionals, as well as practicing health professionals, you know, in a very realistic environment. Realistic in the sense that it mimics what happens in a hospital. And then it is risk-free. The environment is risk-free. You can practice several times, and this helps a lot. You know, training of health professionals has become, in the training of health professionals, it's become necessary to use these electronic gadgets because student numbers have increased over time, and you know, patients sometimes start complaining that students are using them as guinea pigs, you know, so it's become necessary to use these gadgets to train them, you know. So this is a typical simulation room. It's a multi-purpose room, and today we've set the place up for basic life support training. It's training that offers, that equips the trainee, you know, to offer help to someone who has collapsed from cardiac arrest. You know, it's an important intervention that is given to such victims, because within the next 5 minutes or so, if nothing is done, you know, the patient might die. The heart, in cardiac arrest, the heart stops beating, the lungs also fail to provide the oxygen, you know, and the patient may become unconscious, you know, and you do chest compressions, pumping a little bit of air, and it must be done very well, otherwise it will be useless. You know,
you mentioned you mentioned earlier that some of the mannequins are either fidelity, high fidelity,
or low fidelity.
Or low fidelity. Yeah. What does that mean?
This particular mannequin is in between. You see, in a typical low fidelity mannequin, it's just a model. But in a high fidelity mannequin, you are able to get a response from the mannequin. For example, there are mannequins which can talk. Yes, yes. Well, I'll show you one in a short while. You see, with this, it's in between. You see, you can synchronize it using Bluetooth to your phone. So you are able to determine the depth of compression as well as the rate of compression. These are two key elements in basic life support training. If you don't compress the chest very well, you know, you don't get the heart to start resume beating. Take any simulation exercise. There's a pretest to determine the level of competence of the trainee. So they sit over here, they are given exam multiple choice questions on the subject matter to see how much they have assimilated. So these are test stations. We also use this place for examinations. You know, the West African College of Physicians, they've been having exams here. The medical school and other schools also come to undertake exams in the simulation center.
You've seen it all here at the University of Ghana Medical Center located at Legon in Accra, Ghana, and once again, the biggest of its kind in West Africa. And according to the Chief Executive Officer of Ugmc, Dr. Darius Osei, it is open to all. For Metro TV, Bright Nanakwesi Amenin.